What process can we put in place that has the best chance of bringing about continual improvement in the productivity and quality of patient care?
Well, that's the question I think that we have to answer, this most important question in healthcare. And the process I think we need to put in place is something that is basically a market-driven process with consumers deciding the allocation of resources, with the government providing oversight of the marketplace, but the government not deciding the resource allocation. That really should be driven by the consumers. And when you do it that way, you've got the best chance of having a market dynamic that brings about exactly that: higher quality, lower cost over time, productivity improvement in the health sector, innovation to deliver better value to patients. That's, I think, the way to get it, is by having patients be able to control the resources so that when they find something that's high value and low cost, they themselves can choose it and move to it. Right now, so much of our system, the consumers are captured in systems where they really don't have much choice. They don't have the ability to make a choice like that, and it really disincents entrepreneurs from coming up with new solutions to the problem. So I think if you get to the point where the consumers are really in charge of the resource allocation, not in a laissez-faire sense, but with the government providing oversight, but with consumers actually making the choices, I think you could get that disruptive innovation that would lead to higher productivity.
Do you think the chances are good that we can go in that direction?
I think the chances are pretty good. Look, I think the healthcare law pushed us in the opposite direction. But there's going to need to be a correction. I don't know exactly the form and shape of that correction. Something like a repeal and replace is what I favor. But, it could be a move toward a more bipartisan approach in healthcare. I think if that occurred, it almost necessarily would move in the direction more of a market-driven and less government-driven system.